Okay. This morning we've got a 24-year-old female came in with pain adjacent to number 17. That's 3-8 for you boys and girls north of the border. Pericarditis, tooth number 17, so we decided to take out 16, 17, and 32. That's the 8s. She's 24 years old and was a little fearful, so we put her on Xanax to just kind of cut the edge. I always tell them it's like drinking a 6-pack of margaritas. You just don't care. So it's taken us a little bit of time to anesthetize her, and so this is after we've checked for anesthesia, and we've started now. It's about a minute into the video, and what we're going to do is we're looking back here on this tooth, and I want to make sure that the tissue is released. I want to make sure that the tissue is incised where I want it to be cut and it doesn't just tear, because when it tears, it'll tear in the place that you don't want it to. So I checked and there it was free off the distal, so I went ahead and figured that I could elevate this tooth out. We're a minute and a half into the whole process after watching the x-ray for 30 seconds, so we're really into the extraction for about 30 seconds or a minute or so. So I'm using a 301 elevator going on the mesial, and I can see that I've got some movement. I suspected that this tooth was going to come out relatively straightforward, just due to the fact that this is a young white female, softer bone typically, and the shape of the root. Now I would have loved to have gotten her when she was about 15 or 16, before that root developed, but this is the first time I've ever seen her. So one of the most important things is to check to make sure that you do in fact have everything. Notice that there is a little bleeding. It's mostly from that soft tissue, the operculum. We're going to go in and cure it out, make sure that we don't have any debris in there, any bone that will sequester later, or any kind of soft tissue. Notice that the extraction site looks pretty much like where the tooth was. All of this tissue is going to heal, but to be really considered somebody that's doing a good job, you don't want to cause a lot of extra healing for the patient if you don't have to. WDS1 Woodson, it's a plastic instrument. You'll find it in the composite instrument section to release the tissue, and then I'm going to go in with a 301 elevator. I'm not taking, just rushing to try to get this thing out. The fact is I want to be efficient, but that doesn't mean busting off a tuberosity or whatever. Tuberosities will break. Sometimes it's unavoidable, but I find that most often when I foul up something, it's because I've gotten into a hurry. So take your time. 301 elevator, I've got it moving a little bit. If you're going to rock that toward the other tooth, make sure that you're watching it to make sure you don't have anything moving. Big brother of the 301, it's the 34. I'm just trying to get some movement. I've finally got some really good movement now, and the tooth is almost out. Take care not to lose it down the back of the throat. Some people will use a throat pack or whatever. I find that it creates more problems for the patient than it solves, so I just try to take it extra careful. Once again, most important part is to look to make sure that you do have all of the root. So now we're going to look up in there. We're checking to make sure that there isn't a sinus exposure. The controversy is have them blow through their nose or whatever. I was taught if you suspect you have a sinus exposure, treat it as a sinus exposure. when I irrigate with saline, typically if she does have a sinus exposure, she's going to know about it because she will have fluids filling up in her sinus, or she may even have a little bleeding out that nostril. So didn't see a sinus exposure. Clean everything up, wash everything out. I use normal saline. It's hypotonic, or I mean isotonic, not hypotonic. Sterile water is hypotonic. I'm not sure what Paradex is, but it's a disinfectant that you might use in a case if there was a lot of exudate. Now I'm looking at 32. That's 4/8. And notice that there is tissue overlying the distal of that tooth. I want to ensure that it tears where I want it to tear, not where it wants to tear. So I'm going to take a 15 blade and just make a small incision. For everybody that knows me, I like big flaps. But in this case, I don't think a flap is necessary. Just looking at the architecture of the root and everything, that I didn't feel that a full thickness mucogingival flap was required in this case. Got to take it really easy. If you'll notice on 4/7, that's 31 for all of us boys and girls here in the U.S., that there is an all porcelain crown on that. So if I get really vigorous with my 301, I'm going to break that dude, and then I get to fix it or explain why I'm not supposed to fix it. And I try to avoid controversy whenever I can, so I'm going to take it exceptionally careful around that all porcelain crown. I'm getting a little bit of movement, but not the kind of movement that I'd like to see. And once again, with the crown on 3/7, number 31, I don't want to put a lot of pressure on it, so I can't get some of the forces generated on that tooth that I want to see. So, after going nowhere fast, you've got to make a decision. It's I can continue to do this for the next hour and a half, or I can do what's supposed to be done, and I'll pick up a handpiece and trough out on the buckle. Now, notice I don't have a flap reflected. This is one of the things that I like about the straight slow speed handpiece, is I feel I can go right up underneath there, not cause a lot of trauma to the tissue, and make myself a nice trough. The 559 burr that I'm using on this handpiece is the exact same width as the 301 elevator. So now I can get in there, and I'm starting to see some movement on the tooth. Anytime you make a trough, go down the long axis of the root. Don't try to reduce the vertical height of bone. And so now you can see I've taken the big brother of the 301, the 34, and I've got the tooth loose. I noticed that there was some tissue holding it in on the lingual, so I'm going to take my WDS1 Woodson and use that 45-degree side and size that tissue, just kind of blunt dissect it. Notice the extraction site. It's clean. It's there's not a lot of tearing of the tissue. It doesn't look like somebody went in with a chainsaw. That's what I want my extractions to look like. I'm hoping that that's what you want your extractions to look like. That dude is going to heal up as quickly as possible, and everything's going to go well. I'm using a 60 cc syringe full of normal saline. It's got, I think it's an 18 gauge needle on the end of it that's blunted. It's like for composites and stuff like that. I like that 60 cc syringe. It gives me enough fluid that I can rinse things out with. Anyway, she's all done, and she's happy, and she couldn't believe it. And we're coming in on 9 minutes and 20 seconds, 30 seconds with